My students are going to be, you know, a little bit different friends, but they'll be a little similar. I mean, we're, you know, roughly the same height sort of thing. So between stomach 41 and 35 here, there's a total of 16 soon. So if I was going to get to stomach 38, which is right about here, on the crest of the tibia, I'm going to measure downward from 35. So there's 3 soon. Okay. Then I flip my hand. There's 6 soon. See, and then it adds 7, and then 8, and that gets me roughly to where the acupressure point is. And then what you want to do is palpate. There's a small depression you can feel there between the muscle and the bone. That's where stomach 38 is. So if I were to continue to measure, so we go 3, 6, we'll see how close mine is to his. 9 soon. Then we have 12 soon. 15 soon. 16. So it's pretty close between he and I. This is where stomach 41 is right here.
Okay. So you always use your 4 fingers first for like a long distance.
For a
like
long
that.
distance. But there's going to be very few points where we're measuring that far.
Yeah.
Usually it's going to be 3 to 6 soon for most points. So
Okay.
I can't think of any other point that's more than 8 soon for measurement as far as between landmarks that we have to do.
Okay.
So another example, spleen 6, when we learned spleen 6. Spleen 6 is described, here's the location note. 3 soon above the prominence of the medial malleolus, in between the posterior to the border of the tibia. So I'm pushing behind the tibia. So 3 soon. I start right at the medial prominence of the medial malleolus, that's basically the center. There's my 3 soon. I don't add another one. It's where my index finger is falling. That's 3 there. If I push above it, then I'm getting closer to 3.5 or 4. So you have to keep that in mind. You don't skip. That's 3 there. And so this point should be right here, and I can feel the depression right there. So when you're measuring smaller distances, it doesn't make too much of a variation. The idea is that it helps you to get to the point. And when you're on the point, you'll know it. Once you get. So
He knows it.
I'm here. That's a tender point. I'm not even pressing very hard into the acupressure point. And most likely it's probably starting to travel up his leg a little bit. That's spleen 6 there. So, but when we do acupressure points, some of them are soon measurement, some of it's like Li4. It's just in the center of the second metacarpal. So here's the second metacarpal. I'm envisioning where the bone is, and then I'm just going to palpate until I feel the depression. It's right here. I'm in between the muscle and the bone at that point. It's a completely different sensation when you're on the acupressure point rather than being off of it. So, like, say I wasn't pressing in quite the right place. I'm pressing here. He's not really going to feel like it's an acupressure point here. And I'm pressing even harder than I was on Li4. But he's not getting the same sort of sensation. It just feels like I'm pressing into the muscle. Whereas if I go to 115 here and be too soon above the crease of the wrist, in between the radius and the ulna, you have to be specific. This one feels like it's closed up a little, so if I press right away, he's probably not going to feel it too much. So I'm doing a little bit of circular kneading, and now I'm starting to get in the point. I'm going to press here, and then I'm sedating, and then I'm going to sedate more by just turning out and then back in and pull. And so his point's starting to open up some here. And I don't even have to look at his face to know it. Because a lot of times you look at people's faces to see if you're on the point or not, because sometimes they're like, they'll do something. I try not to look for any cues like that from people. So, so that's what I'll try to teach you guys in point location class, like how to be on the point, how to measure what the boning landmark is. Another example is Li15. Now Li15, all the direction says is it's anterior and inferior to the lateral end of the acromion process. The acromion process forms from the spine of the scapula, and basically that's you're looking at the AC joint here. And so what you do is you have to palpate. In this position, the point's a little more open, so I'm palpating for his acromion process. And then I have to move a little anterior, inferior. In his case, I'm going to lift his arm up slightly to get on the point, because his shoulder's anteriorly rotated. So if I lift up some, that'll help me get into the point. And now I'm getting into his Li15 here. So this one's just by feel, by anatomical structure is what you're feeling
Right.
for as your guideline, rather than measuring soon. So it'll switch for every acupressure point.